afternoon. Welcome to our poster presentation, a behavior analytic training model to reduce restraints in an emotional support center-based program. My name is Ashley Harned, and I am an educational consultant with the Pennsylvania Training and Technical Assistance Network, also known as PATN. I'm here with my colleague, Dr. Bruce Tinor, Program Administrator and Principal with the Early Learning Academy. We want to give a special shout out to our colleague, Dr. Willow Hozella, for his collaboration and support with this case study and poster session. We would also like to thank Mr. Mike Mikolos and Dr. Amiris DePuglia for this opportunity to present the outcomes of this case study. On behalf of Dr. Hozella and Dr. Tinor, I just want to thank you for joining our poster session. We are so excited to be here today to share how this behavior analytic training model has led the teachers of the Early Learner Academy to implement evidence-based instructional practices that have resulted in significant changes in the lives of their students. Now I will turn this over to Dr. Tinor.
Thank you, Ashley. Again, my name is Dr. Bruce Tinor, and I am the Program Administrator for the Montgomery County Intermediate Unit. Our program is located at the Early Learning Academy. I have the pleasure of supervising the Intensive Emotional Support Program. Our grades range from kindergarten through 6th grade. In our building, there are 4 classrooms. Our staff makeup consists of 4 teachers, 5 paraprofessionals, 1 personal care assistant, 1 board-certified behavior analyst, 1 physical education teacher, 1 licensed social worker. We also have 30 students in our program. In the fall of 2019, I contacted PATN for consultation, training, technical assistance, and behavioral support due to a significant amount of physical restraints. There were 90 physical restraints that occurred by our staff to stop crisis behaviors in the first 2 months of the 2019 and 2020 school year. The collaboration and consultation with PATN began in November of 2019. This poster details a behavior skills training model, also known as BST, to teach staff specific skills to prevent problematic behaviors that result in the need for physical restraint. The staff in our 4 classrooms are in an intensive emotional support center-based program, and they participated in the training package that included stand and delivery style training, followed by in-class consultation to model the procedures for which training had been conducted. Following training, fidelity checklists and for the implementation of the procedures were conducted and used to inform future trainings. Consultants also provided in vivo training whenever necessary by working directly with students while staff observed. The consultants would then observe staff, conduct the same methodologies, and provide feedback on staff performance. Data was analyzed on the frequency of physical restraints across the 4 classrooms to compare frequency of restraints before and after behavior skills training. Now, the independent variable was a training package with a focus on in vivo training, fidelity checklists, and direct feedback to staff. The dependent variable was the pre and the post measure of the frequency of physical restraints before and after staff participation in the BSC package. Now my colleague Ashley will discuss the methodologies of this study.
The collaborative consultative model we utilized focused on establishing a multi-tiered system of supports for academic and behavior, including defining school-wide expectations, school-wide system of reinforcement, adoption of reading and mathematics curricula K through 6, training staff on the critical components of positive behavior support plans, and increasing active student responding during instructional sessions via evidence-based practices. For example, direct instruction, errorless teaching, formalized error correction, and formative assessment techniques. These training focus areas were identified by conducting the quality indicators of emotional support services and programs, which we used as our baseline assessment. Following completion of the baseline assessment, an action plan was developed with the team. The action plan is updated annually based on fidelity checks, classroom observations, and staff training needs. We also conducted an initial review of all students' behavior plans and provided feedback on these plans to the BCBA, who's responsible for supporting classroom teams with implementing. The consultation consists of staff training followed by in-class consultation. Staff observe the teaching methodologies that were modeled by patent consultants working directly with students. Fidelity checklists are conducted by the consultants, the administrator, and BCBA on staff to identify any additional training needs or necessary procedural revisions. When the COVID-19 restrictions began, patent consultants were unable to model with students directly. So we arranged to view instruction virtually and provided feedback to the instructional staff immediately following those observations. Data from these observations were also used to inform future training considerations. Inter-observer agreement, also known as IOA, was measured for critical components of positive behavior support plans and group instruction teaching methodologies. IOA for both measures was scored at 100%. This chart details the training package implemented. Consultation and training included observing instruction within each classroom, completing treatment integrity data checks on staff implementation of effective instructional practices, modeling effective instructional techniques, such as the use of a promise reinforcer, developing behavior contracts, and using different schedules of reinforcement to teach new skills, including token economies and differential reinforcement procedures. This chart shows the schedule of consultation and training conducted with all staff. Some of the trainings included are behavior management, direct instruction, social skills, conducting functional behavioral assessments, as well as development and implementation of positive behavior support plans, which were derived from the functions identified, writing evidence-based, standards-aligned IEPs, and schedules of reinforcement. There were 9 training sessions that were each 3 hours long. Trainings were conducted in person and virtually. Trainings aligned to the action plan targets identified through the quality indicators of emotional support services and programs baseline assessment. Dr. Tinor will now cover the final results of our case study.
This case study was designed with the end goal in mind, changing teacher behavior to lead to socially significant outcomes for students with emotional disturbance and the histories of frequent crisis level behaviors. Following baseline, delivery of the training package began. All critical components of the behavioral skills training, which includes instruction, modeling, rehearsal, and feedback, were implemented. The behavior skills training included stand and deliver presentations with embedded active responding from the participants, followed by in-class modeling with students and direct feedback from consultants and administrator. Fidelity checks were used when providing feedback to staff and when identifying training needs. Now, due to COVID-19 school closures, it was not possible to collect frequency of restraint data for 6 months. The delivery of the behavioral skills training had to change to a virtual format. An A-B design was utilized because a return to baseline frequency of restraints was neither ethical nor achievable following the behavior skills training. The procedures consist of a baseline condition where historical data related to the frequency of restraints was reviewed and an assessment, which was the quality indicators of emotional support services and programs, was conducted to identify critical training areas. For this case study, the dependent variable, again, was monthly frequency of restraints across the 4 classrooms, and the independent variable was a training package utilizing methodologies and principles of applied behavioral analysis, as well as fidelity checks were maintained whenever possible. Upon return to in-person instruction, the reduced frequency of restraints following the introduction of the training package maintained with a high of 10 restraints in November of 2020 and a low of 0 restraints from April 2021 through May of 2021. Let's take a closer look at the results of our case study. The data is a representation of 2 years of continuous collaboration, training, and technical assistance with patent consultants assisting our 4 classroom teams here at the Early Learning Academy. This data represents the total frequency of restraints from September 2019 through May 2021. At baseline, there were 90 total restraints implemented. Upon implementing the training package, there were a significant decrease. Then COVID-19 occurred. When school reopened to in-person instruction, a high of 10 restraints again occurred in November 2020 and a low of 0 from April through May of 2021. These outcomes show a significant reduction in frequency of restraints in a center-based emotional support setting serving 22 school districts within the Montgomery County Intermediate Unit. The data trend and maintenance of staff skills are evident by the fact that the largest spike following the reopening of the intensive emotional support center-based program remained at the lowest following the initial implementation of the training package. Most importantly, restraints never returned to baseline and are on a downward trend. Ashley will now discuss limitations of the study.
Thank you, Dr. Tinor, for sharing this powerful data with us. There are limitations to all case studies. In this study, we had a small sample size, which should be addressed through replication and extension of our training package in other emotional support programs. Treatment integrity of training methodologies was not conducted. A full data set was not available due to COVID-19 pandemic and school closures. Now, I will turn this back over to Dr. Tinor to give you a brief synopsis of the study.
Thank you, Ashley. This study focused on staff training that included on-site consultation, in vivo modeling of teaching procedures with students, direct feedback, including fidelity checklists that were correlated with the reduction in frequency of restraints. The consultation and the in vivo training focused on teaching methodologies to promote active student responding, systematic use of reinforcement, and appropriate skill sequencing in our 4 center-based emotional support classrooms. The patent consultants provided pragmatic methods to staff that successfully increased socially acceptable behaviors and significantly decreased problem behaviors. Training should include in-classroom consultation to provide staff with the opportunity to watch trainers implement procedures for which staff have received training. Fidelity checklists for teaching methodologies were used for prescriptive and constructive feedback to all staff. The staff who participated in the behavior skills training model demonstrates successful performance in the implementation of training components, such as a decrease in physical restraints across all students. Now, I will cover the implications for consultative practices in public education. As an educator and administrator for several years, I have seen firsthand the positive outcome of implementing effective instructional practices to change student behaviors, as well as provide classroom team members the skills they need to prevent crisis behaviors and teach replacement skills that lead to students becoming successful and independent in their school, home, and community. In summary, emotional support classrooms benefit from behavior analytic, conceptual analysis, and methodologies. Ashley will now discuss the implications for applied settings.
Teacher training focused on antecedent manipulations, teaching skills at the appropriate instructional level, and increasing active student participation during instruction as variables to reduce problematic behavior that in the past resulted in restraints will provide teachers the necessary skills to prevent problem behavior from ever occurring. direct instruction and effective instruction methodologies such as errorless teaching, differential reinforcement, fast-paced instruction, increasing student responding has all shown to reduce motivation to engage in escape maintain problem behavior. Our hope is to continue this effort by assisting Dr. Tinor and his team in identifying criteria for students exiting the center-based placement to return to their home districts. We plan to develop an intake process to assess and intervene as soon as the student enrolls. Additional efforts include refining data collection methods, establishing mastery criteria for fluent generalized responses, and social skills training. We will continue to provide behavior support with writing function-based positive behavior support plans that include the effective components for behavior reduction, especially reducing motivation to engage in the problem behavior and teaching replacement behaviors. Staff training will include how to use fidelity checklists to inform instruction and continuing to develop staff skills in application of behavior analytic interventions to ultimately impact student outcomes. All of this will align to the students' IEPs and their IEP goals. Applied behavior analysis is an effective intervention for all students across all environments. If you have any questions, please feel free to join us at the live Q&A at 5 p.m. Thank you again for attending our poster presentation.
Thank you.